Good afternoon to one and all present. I am Dr. Rakshita. On behalf of Preventive team, I welcome you all who have joined the webinar titled AMR Crossing Continents, Policy Coherence in International Trade Regulations. The initiative is a part of Preventive project implemented by the consortium comprising 5 Indian universities, 4 European and 2 non-governmental organizations. The vision of the project is a future where every individual is aware of antibiotic resistance and is empowered with the right education to address the issue. I would like to give a brief overview about the webinar. We now live in a world where we can presume that we'll be able to treat most infections by simply taking a pill. Things are, however, changing. Antimicrobial resistance is threatening us to return to a world where even the smallest disease may be fatal. Like climate change, the drug resistance does not respect geographical boundaries. Trade and AMR intersect in many ways. On a fundamental level, the mobility is linked to dissemination of microbes, and there is a clear connection between travel routes and evolution of AMR. Effective governance and regulations are required for optimizing antimicrobial use to protect global health and achieve economic growth. From the webinar, you all will be able to learn about policy frames on AMR, existing binding and non-binding mechanisms to avoid AMR crisis, need for coherence in international trade agreements and non-binding mechanisms. Before beginning the session, I would like to give some technical details of the webinar. It has been conducted in Zoom and streamed on YouTube Live. Questions to the speaker can be asked by typing in the chat box of YouTube, beginning with #AskPreventive. 15 minutes is kept aside for the same question answer session. To add on, the webinar is being recorded so that those who are unable to attend the live session can watch it on YouTube of the Preventive channel and on Facebook, Twitter, and LinkedIn pages of the project. We are extremely happy that we could get on board an eminent speaker who is working exclusively in the field of health policy, Dr. Sanjay Pattanshetty. Currently, he is working as an associate professor in Prasanna School of Public Health, Manipal Academy of Higher Education, Manipal, since 2010. Completed his MD in Community Medicine from Manipal Academy of Education and double masters in Public Policy and Human Development from United Nations University and Maastricht University, the Netherlands. He has over a decade of experience in public health education, program development, implementation, field research, and practice. His research interest comprises implementation science, situational analysis, leadership in public health, and policy discourse. He has published more than 40 articles in national and international journals with an H-index 8. Scientific project development, health system project management, innovative health system methods, external stakeholder engagement, and strategic communication at the national and international levels are some of his key competencies. We shall begin the day session now. I request Dr. Sanjay to kindly proceed with the talk.
Good afternoon. Thank you, Rakshita. Thank you, all the organizers and the team from the Preventive for giving me an opportunity to participate in this webinar. So the outline of today's webinar is Trade and Health Framework for Antimicrobial Resistance, Health Perspective, AMR and SDG, overview of the objectives of WHO, FAO, and OIE action plans, policy avenues for averting the AMR crisis. Health perspective is basically, you would have listened to this health perspective from the previous speakers, but I want to build on what is existing and take you to public policy perspective and the trade perspective. Antibiotics as a public policy perspective, we have public good and a tragedy of commons as two concepts. Antibiotics policy framing, beyond health, how we can frame AMR as a policy issue is what I will talk in this particular segment. And then AMR governance in the international trade perspective. So insights from international legal instruments, coherence of trade agreements, and how trade agreements have to coherently work with WHO and FAO binding and non-binding mechanisms. Some case studies, need for AMR treaty, and health in all policies approach, and how we can use this approach to tackle antimicrobial resistance. I would tell you, this presentation is intense. Some topics are difficult to comprehend, but I suggest you to read further after this presentation and note down few key concepts related to trade and read further. So trade and health framework for antimicrobial resistance. The most important sector in terms of trade relating to antimicrobial resistance is in livestock, food animals, and their feed, particularly in animals that host resistant bacteria. Trade is possible route for spreading resistance. So that is one perspective where you can look at trade as a possible route. So what is the conflict of trade and health? Where animals are tested for resistant strains as part of the efforts to control the spread of AMR, it is likely to affect the trade immediately, as animals with positive results would be banned from the market. Trade antimicrobials also affect their availability for human and animal consumption. So the part of the complexity of addressing antimicrobial resistance is balancing access to medicine against overconsumption. Little is known about the effect of counterfeit trade in animal drugs, because trade also affects the availability of substandard counterfeit antimicrobial drugs. Trade in counterfeit drugs is estimated to run in billions. Availability of substandard antimicrobials is likely to undermine attempts at public regulation of antimicrobials, such as oversubscribing or the provision of antimicrobials through informal providers. And the last one is trade in services. This includes the movement of health workers, medical tourism, foreign direct investments in health system. The last component, trade in services, we are not covering in detail today because that comes under new different WTO, World Trade Organization regulations called as GATS, General Agreement in Trade in Services. So we will not go deep into that, but however, if you want to read or know more about it, you can always talk to us later. So introduction. Antimicrobial resistance is internationally recognized as a global threat to humans, animals, environment, and consequently health security. You would have listened to this statistics in the previous presentation. I will not focus more on this, but I will focus on how you can apply trade and WHO and FAO binding and non-binding mechanisms in addressing AMR and AMR governance. So a borderless threat like AMR requires global governance mechanism to mitigate its emergence and spread. And it is the responsibility of all countries and relevant multilateral organizations. In this presentation, we put forth arguments and insights from various published and great literature that both binding and non-binding mechanisms are two approaches or methods in averting AMR crisis. This presentation will emphasize the need for policy coherence and coordinated action mechanisms to address the rising menace of AMR. So I would like to highlight some of the objectives of WHO, FAO, and OIE action plans. The reason I have put this information is in the later slides, you can very well relate how WHO, FAO, and OIE can work along with the international trade regulations. As you all know, there is a 2015 WHO Global Action Plan on Antimicrobial Resistance. They work on awareness and understanding. They work on surveillance and research. They work towards reducing the incidence of infection by promoting sanitation, hygiene, and infection control measures. They advocate for the optimized use of antimicrobial medicines, and also they develop the economic case in terms of investments and the utilization. And there's a 2016 OIE strategy for antimicrobial resistance. They also talk about awareness, understanding, but they talk about in the perspective of consumption in animals. And FAO Action Plan on Antimicrobial Resistance, they talk in the context of utilization of antibiotics in agriculture and other plant products. So in common, three organizations are working in primary prevention in terms of education, understanding. Then they work in second level and the next level of prevention in terms of going ahead in surveillance, governance, and prudent use of antimicrobials. So I suggest and I request you to remember these tripartite work which is happening between WHO, FAO, and OIE. This is mainly from the health perspective. If you are looking from a perspective as a health professional, you will focus mainly and majorly on WHO, but also you will think about OIE and FAO work in antimicrobials. However, when we talk about antimicrobial resistance, there is a perspective related to public policy as well as trade. That is what I will cover from now on. Some of the policy avenues for averting the AMR crisis as per WHO, FAO, and OIE I have listed here, which you can refer also in some of the documents. So what I mean to tell you is you have policy avenues for averting the AMR crisis from this tripartite group, WHO, FAO, and OIE. But we can do further by collaborating with other sectors. So public policy perspective, when I talk about antibiotics, it's a public good and the tragedy of commons. These are two concepts. Public good, when do we call a good as a public good is when it is non-exclusive and non-rivalry. Non-exclusive meaning if someone wants to use it, they cannot be excluded from it. Non-rivalrous meaning one person's consumption does not affect another person's consumption. Although antimicrobial effectiveness is non-exclusive in the sense that it can be used by everyone. However, it is rivalrous. Even prudent use of antibiotics provides an opportunity for bacterial resistance to develop. So one person's consumption does affect another's consumption. So this is from a policy perspective. Next, economic theory in terms of tragedy of commons. As a global common good, antibiotic effectiveness is vulnerable to the tragedy of the commons, where a shared limited resources is overused by a community when each individual exploits the finite resource for their own benefit. So overexploitation of shared finite resource leads to resource depletion and the collapse of a common good. So when we talk about overconsumption, overutilization of antibiotics, so it's a kind of an overexploitation, which we will see a day where we are left with few antibiotics or no antibiotics which are effective against even the common infections. So we need to keep these two concepts in mind, public good and tragedy of commons, when we think about how to prevent this AMR problem. So policy frames on antimicrobial resistance. AMR as a healthcare problem is researched, disseminated. People have made noise in United Nations General Assembly and World Health Assemblies. There are a couple of documents which have been written, advocated for global action for preventing antimicrobial resistance. But that is only one perspective. You you should see AMR as a developmental issue. You can also see AMR as an innovation challenge. You can see AMR as a security issue. You can also see AMR as a One Health challenge. So how you frame your problem means a lot for policy actions. So remember, beyond healthcare perspective, there are other perspectives in policy framing which we need to look at. And when we design an AMR governance strategy, we need to consider each one of them, and actors and sectors are different who are dealing with antimicrobial resistance with equal interest to address this. So when we talk about AMR, it's a delicate balance of conflicting goals. A successful policy must strike the right balance between access, conservation, and innovation. Three conflicting elements that must be addressed satisfactorily and fairly contain AMR. One is stewardship, where we talk about conservation of the antibiotics, not over-exploiting it. So, however, here conflicting goals between trade and health can constrain access and undermine current innovation. So we need to see that from that perspective as antibiotic stewardship in the context of trade and other regulations. Innovation for new antimicrobials. However, innovation needs to be accessible, and innovation without conservation is wasteful. Trade-related intellectual property rights, that's the TRIPS agreement, and subsequently the Doha Declaration, where developing countries and least developing countries were given certain provisions to use and manufacture generic medicines. But however, we should be careful. Access should not lead to overconsumption and exploitation of the existing antibiotics. Access to antimicrobials for the millions of people without them. However, increased access without conservation and innovation will speed up resistance. So it's a delicate balance of conflicting goals, and policy field is always conflicting and managing, negotiating the conflicting goals. So global governance of antimicrobial resistance, you have sectors, actors, and frames. If you frame this as a human health, international organization which will come and play a major role is WHO. Who would be the national actors? Ministry of Health. Main concern of them is health impact of AMR on human health. Strategies is conservation. I would like to have an antibiotics to most of the people, so I conserve and I preserve and I give it to people who need it. And frame is a healthcare and One Health. But if you move to animal health, the agenda, the actors, sectors, strategies, frames will change. Food system, FAO is a major player. Environment, United Nations Environment Program also play a key role in antimicrobial resistance. When you talk about development, UNDP is the key actor. When you talk about trade and IP, WTO, World Trade Organization, and WIPO. What is WIPO? World Intellectual Property Organization, and the Ministry of Trade will play a major role in containing and talking about utilization of antibiotics. And the security, the UN Security Council, again, it's a Ministry of Foreign Affairs. So AMR as a threat to security systems, so surveillance, containment. So the major frame you use is in the context of international theories, and you apply concepts of security. So what I would like to tell you here is AMR is not restricted to one sector, one actor, and one frame. Global governance needs global responsibility and global accountability in terms of coming together and showing solidarity to solve this AMR problem. No one sector or an actor can address this problem. It is cross-cutting, and we need to work together, addressing conflicting goals, balancing access, innovation, and conservation. When you look at the strategies under each of these human health, animal health, food system, so it is either conservation, either it is access or innovation. So remember, this, that global governance of AMR can cut across sectors, actors, and frames. So when we talk about AMR governance, what we know till now, we understood what FAO, OIE, and WHO are up to in their policy avenues in averting AMR crisis. Then we looked at certain policy frames as well as global governance frames for actors, sectors, and frames. Now we talk about core AMR governance. You know, it's a borderless threat. Previous presentations and experts have discussed with you how antimicrobial resistance is prevalent in different parts of the world. So it requires a global governance mechanism to mitigate its emergence and spread. This can be in the form of legally binding global governance mechanisms such as treaties and regulatory standards, non-binding mechanisms such as political declarations, resolutions, or guidelines. So emphasis is placed on One Health approach in both legally binding and non-binding governance mechanisms. A collective action is required in areas of access, conservation, innovation for successful containment of AMR emergence and spread. So what different between binding mechanism and non-binding mechanism in a policy language? When we say binding mechanism, it's rigid text. Text is very rigid. Amendments have to go through ratification because individual member countries have to ratify the amendments and agree to what you say. Legal consequences of binding governance mechanisms if states fail to meet their commitments. So there will be legal implications if I do not adhere to the binding mechanism as a country. Binding legal mechanisms contain financial and logistical support built in for implementation as well as reporting systems, features not often seen in non-binding governance mechanisms. Non-binding mechanisms are flexible, quicker and more adaptive options. Non-binding mechanisms allow for more dynamic discourse and better responsiveness to changing global priorities. They provide political and legal significance without incurring the legal consequences. However, non-binding mechanisms also lack the credibility of binding instruments because they are not nationally ratified and therefore have no legal effect on national practices. Binding and non-binding mechanisms have their own strengths and limitations. It's for the leaders to decide and commit to what problem we want to address and come together, adhere either to the binding or the non-binding mechanism. The most important is how we implement both the legal mechanism and the non-binding mechanisms to avert the AMR crisis. So what are the examples of binding mechanisms we have? Article 19 and 21 of the WHO Constitution. Till date, Framework Convention of Tobacco Control is the one strategy implemented by the WHO as a legal binding agreement. They used it for the first time. And the second one is the International Health Regulations, IHR, where you report the public health emergency of international concern. You have Article 14 of the Food and Agriculture Organization, FAO, where you need to ratify your agricultural regulations, utilization of chemicals, pesticides, antibiotics, and different components which you use to promote agriculture. That can be ratified in the Article 14 of the FAO. Next is the World Trade Organization agreements. You have sanitary and phytosanitary agreements, technical barriers to trade, and trade-related aspects of the intellectual property rights. Basically, sanitary and phytosanitary agreements deal with health of plants, animals, and humans. Technical barriers to trade deals with any technical regulation. It can be from regulations related to seat belt to your technology related goods to even the pharmaceuticals, labeling, all come under technical barriers to trade. Trade related aspects of intellectual property rights talks mainly about innovation, access to medicine as one of the examples related to TRIPS. Non-binding mechanisms, which we most often come across, is the 68th World Health Assembly endorsed in the Global Action Plan to tackle AMR. 71st United Nations General Assembly did a political declaration of the high-level meeting on antimicrobial resistance. There's an interagency coordination group on AMR to provide guidance on global actions. G20 health ministers, the Berlin Declaration of G20 health ministers emphasized AMR as one of the areas which globally people have to work on. Global Action Plan on AMR is the other non-binding declarations which happened in 2015, 2016. So binding mechanisms and you have non-binding mechanisms. This is not to say that we need to work in one area and the other area is weak, or the other area is strong and the other area is not so strong. It's about how do we bring together the binding and non-binding mechanisms so that we avert this AMR problem. So mechanisms of convening a treaty under the authority of the technical agencies. When I say FAO and WHO, because now we are talking about trade regulations, health regulations. FAO and WHO, as I told you, it's about Article 14 and Article 19 and Article 21. So there should be 2/3 of the member countries should show the majority to ratify this treaty. So there's a potential scope as a FAO mandate, WHO mandate. Article 21, the scope is designed to prevent the international spread of disease. However, if you apply the Article 19, you need not define the scope, but it's automatically applied to all the countries, and they have a mandate to implement the treaty. So this is from the perspective of WHO and FAO. And when you talk about trade agreements, you have many like that, which you can use, as well as you can look for which policy frame I will use to bring policy coherence. One is international health regulation. This is an international legal agreement through the World Health Organization that promotes global health security by building capacity to detect, assess, report, and respond public health risks. You have sanitary and phytosanitary measures, an international legal agreement under the World Trade Organization to support the right of the governments to protect food safety, plant, animal health, and prevent these sanitary and phytosanitary measures from being unjustified trade barriers. All the regulations should be supported by science before you apply sanitary and phytosanitary measures. Agreement on trade-related aspects of the intellectual property rights is an international legal agreement between members of the WTO which sets minimum standards for the regulation of intellectual property by national governments. Technical barriers to trade, an international legal agreement under the WTO that ensures that technical regulations and standards are non-discriminatory and do not create unnecessary obstacles to trade. Please remember SPS, TRIPS, and TBT, technical barriers to trade, trade-related intellectual property rights, and sanitary and phytosanitary agreements. These three are very much important when we talk about antibiotic usage, especially the sanitary and phytosanitary agreements in consumption in food, animals, plants. Sanitary and phytosanitary agreements can set a stringent standards so that we do not prevent access, but at the same time, we promote good conservation of the antibiotics. You have harmonized commodity description and the coding system. This you can use at the level of customs. When you are trading different medications, drugs, harmonizing the description, classification, and coding of the goods in international trade. Even before the antibiotics enter your country, if you channelize your harmonized commodity description and coding system, you can actually tackle the problem related to counterfeit, substandard antibiotics. There's a Basel Convention on control of transboundary movement of hazardous waste and their disposal, Rotterdam Convention on prior informed consent procedure for hazardous chemicals and pesticides, and there's a Stockholm Convention on organic pollutants. So you have trade and legal instruments with you, but most importantly is how these trade agreements are working coherently in consultation and in collaboration with WHO, FAO, and other organizations. when I say there should be relevant standard setting organizations. So FAO and WHO play a standard setting role for food safety. Animal health is played by the World Organization for Animal Health. FAO, International Plant Protection Convention for Plant Protection. So standard setting organizations have an important role since World Trade Organization members are obliged to base regulations on relevant international standards. By setting stronger regulations, these bodies can help tackle antimicrobial resistance and contribute to achieving the Sustainable Development Goals. So coherence of WTO, World Trade Organization, WHO, FAO, and OIE. When you observe this table closely, to improve access to antimicrobials, you have three majors. One is develop equitable pricing and licensing models to support access to antimicrobial in resource-limited settings. So the trade-related intellectual property rights, ensuring that innovation and access to all the countries is happening. For example, there's a Doha Declaration under trade-related, which ensures access to drugs. At the same time, they need to work with WHO, FAO, and OIE strategies so that they can ensure this equitable pricing, essential medicine that reach people. And second is end of manufacturing, sale, and export of substandard medicines. You have technical barriers to trade, and there's a harmonized commodity law, which will help you to describe, classify the medicines. At the same time, they also need to work with WHO, FAO, and OIE strategies. Health systems to improve infection prevention and control. Again, the technical barriers to trade. So what are your technical regulations to ensure that you prevent the infection prevention and control? You implement infection prevention control measures at certain levels. So when I talk about access to antimicrobials, trade agreements, legal instruments, and the WHO, FAO, and OIE have to work together to set a policy frame to avert AMR crisis. So we always try to balance between these three: access, conserve, and promote. Similarly, when it comes on the conservation front, promote the responsible use of antimicrobials in animals and agriculture. Your sanitary and phytosanitary agreement can play a major role by abiding to the standards set by FAO and OIE and ensure that antibiotic usage among plants and animals are used as recommended. So WHO, FAO, and OIE have to work with SPS, that is Sanitary and Phytosanitary Agreement policies, regulations to ensure that key antibiotics are conserved. And in the context of innovation, you have international health regulations where they promote good investments have to happen in health systems, as well as delinking, research and investments related to newer antimicrobials, innovations. And that can be supported by the trade-related intellectual property rights, technical barriers, and harmonized commodity descriptions. So when you understand this particular table, this is tip of the iceberg, what I'm talking. You can understand the complexity of antibiotics, access, conserve, and innovation at a global level. How this can be managed and how complex this is to manage. So health perspective of AMR is one perspective, but if you go beyond that, you have the world which needs coherence and solidarity to address AMR crisis. These are some of the examples. I'm not going to go deep into this and talk about each examples, but if you look at it, and anyway, this presentation you can see later also, you see how IHR, WHO, FAO, sanitary and phytosanitary agreements have to work together for the responsible use of antimicrobials in humans, animals, and plants. So think beyond the limits of microbial resistance, what you see only in human beings. Look beyond that. There are several organizations which are working in different policy frame with different actors and sectors. So some of the case studies is European Union review of legislation on veterinary medicinal products. The sanitary and phytosanitary agreements, the standards, there is a provision where individual country can decide what should be my standard setting policy for antibiotic usage in plants, animals, food animals. So there was a case where in July 2018, Argentina raised concerns regarding the European Union proposed regulation on veterinary medicinal products, stating that adoption of provisions regarding the use of antimicrobials in the veterinary sector would have a significant impact on international trade. Argentina was concerned that the proposed text, which was the formal text adopted by the European Parliament and the Council of Europe, would require exporters of animals and animal products to meet EU standards, that is European Union standards, concerning the use of certain antimicrobial medicinal products, as well as specific usage provisions as a condition for maintaining access to EU market, despite the differences in prevailing sanitary conditions. So what is this basically? I have for example, I have sanitary and phytosanitary regulations, and I have set that a very high level as a country. So any product which is entering my country has to meet that standard. So European Union has set that high standard for this. So Argentina applied for a dispute settlement in the World Trade Organization, saying that what EU is doing is a trade restrictive measure. So such kind of dispute settlement cases are happening, and this is one such case where individual countries fight and try to negotiate, saying that we have different standards, and quote that the antibiotic level you use are not as per the standards set by the European Union. So you can understand how we are relating to what we discussed in the coherence of sanitary and phytosanitary agreements between different countries. There's also a case study on counterfeit antimicrobial drugs. According to the Pharmaceutical Security Institute Counterfeit Incident System database, the term counterfeit refers to the report of a medicine that was deliberately and fraudulently produced or mislabeled with respect to identity or sources to make it appear to be genuine product, whatever the brand or generic. Despite recognized dangers to global public health, reports compiled by public and private stakeholders, including law enforcement agencies, regulatory agencies, show that scope, production, distribution, and sale of substandard, spurious, falsely labeled, falsified counterfeit medicines continue to increase. You can refer to the article which I have quoted here. You will get full details related to how counterfeit medications are in the international market, and that is not good, because that will definitely lead to antimicrobial resistance. Substandard drugs are not good. There's a dispute settlement case between the United States, measures affecting the importation of animals, meat, and other animal products from Argentina. This dispute concerns the United States maintenance of an import prohibition on all foot and mouth disease susceptible animals and animal products from Argentina, imposed following an outbreak of foot and mouth disease in northern Argentina in 2001. So what was the argument of the Argentina? Argentina argued that the ban lacked scientific justification and was contrary to international standards, without a valid risk assessment, and in a discriminatory manner that was more trade restrictive than required to meet US level of protection. So again, what I'm trying to say is the role of sanitary and phytosanitary agreement, technical barriers to trade need to be negotiated at WTO level to bring coherence in these kind of issues of importation of or export of animals, meat, animal products. AMR concerns in the transatlantic trade and investment partnerships. You have WTO as an agreement, like World Trade Organization. Member countries become signatory to that, and follow the norms of WTO. Transatlantic Trade and Investment Partnership Agreements are the regional trade agreements outside of the WTO. According to the research led by the Johns Hopkins Center for a Livable Future, antibiotic usage in food animal production plays a significant role in the growth of antibiotic-resistant bacteria. In the US, 80% of the antibiotics sold are used in food animal production. Despite decades of scientific evidence linking such as antibiotic resistance, little has been done to reduce antibiotic in US animal agriculture. While the European Union maintains tough standards, current inconsistencies are cause for great concern during transatlantic trade and investment partnership. What I'm trying to tell here is when we negotiate regional trade agreements, we negotiate trade text, the kind of words which we articulate when we are signing the trade agreements. If in the transatlantic trade and investment partnership, we agree to a standard which will lower the standard and promotes and harms the antibiotic access, conservation, and innovation, we need to worry about antimicrobial resistance. So what they try to tell in the transatlantic trade and investment partnership is to harmonize regulations between two markets and remove all the non-tariff barriers. So what experts suggested is, if not properly addressed in terms of the text related to the antibiotic conservation, the negotiation could lower European Union antibiotic use standards simply to facilitate trade with the US, putting both sides of Atlantic at risk. So again, this is a case study where what kind of text we need to use when we are signing regional trade agreements. And we have a Trans-Pacific Partnership Agreement, which is also a regional trade agreement. So primarily concern was Australia's trade policies need to be calibrated and sensitized to ensure unintended consequences of regulatory coherence, harmonization, trade facilitation. So one of the authors mentioned that the committee has been alerted to the dangers presented to the health security of Australians by antimicrobial resistance. So the committee recognizes the problem in antimicrobial resistance and Australia's current regulatory framework, which enables Australia to control antibiotic use. So I think we need to be cognizant about what kind of text we articulate when we are signing regional trade agreements. So again, the policy coherence is needed in terms of problem related to antibiotics and antibiotic resistance. So what we have learned till now, we started with regulations in WHO, FAO, and OI. We looked at binding and non-binding mechanisms. We looked at what are the binding mechanisms in WHO and FAO, that is Article 19, Article 21, and Article 14. Then we looked at what are the international legal trade regulations like technical barriers to trade, sanitary and phytosanitary agreements, and trade-related intellectual property rights, where these three talk mainly about access, conservation, and innovation. Having understood this binding and non-binding mechanisms, we looked at the case studies of Argentina, and also we looked at how we need to be careful when we sign regional trade agreements in terms of clarity in text related to antimicrobial resistance. So there was one more case study where the Scottish foreign minister, when they were signing UK and Japan free trade agreement, he emphasized, he's a trade minister, failure to secure a commitment in the UK-Japan FTA, tackling antimicrobial resistance, which reduces the ability of antibiotics, would be a missed opportunity for the UK government to show is serious about AMR in future negotiations. So it's very important when we negotiate WTO agreements, regional trade agreements, and free trade agreements, mainly the text related to AMR. So AMR is also an international affairs issue. It's a policy coherence in health, economic, and trade obligations is needed. There's a policy coherence in investment agreements promoted in bilateral and regional free trade agreements, because when we talk about investment agreements in free trade agreements, the government can really face investor-state dispute settlement issues when they would like to deal with antimicrobial resistance. So the governments are challenged by the companies. So we have to be careful when we articulate the text. Free trade agreements can be used to sue governments for implementing policies or regulatory challenges to occur to AMR. For example, corporations can challenge domestic or import production standards for fruit production processes or labeling requirements, many of which may compromise AMR strategies. The health tourism initiative leading to greater AMR transmission globally is in the context of trade in services, in terms of travel of a person or travel of people to for medical tourism, get treatment in developing countries, but also there is a risk of antibiotic resistance in this process. So certain stringent regulations are needed in this context. But in today's presentation, we are not covering that because that comes under general agreement of trade in services, which is in depth a new presentation altogether. But this is for you to look and read further. So in the larger context, if we have to discuss about how good we are doing in global AMR efforts, one example is you compare with the Paris Agreement, which is related to the climate change. Do we have a collective global goal? When you look at global AMR efforts, there's no consensus on what a common global goal would look like. Nationally determined contribution pledged, reviewed, and ratchet every 5 years. No review process or ratcheting mechanisms currently existing. So we need to understand if we have to design an AMR treaty, are there existing mechanisms which we can adapt to bring policy coherence? This is just one example which you can read further later. So why there is a need for AMR treaty? A study by Hoffman found that for treaties to be effective and yield positive results, they need to fulfill the following criteria. It should be a transnational problem. End goals should justify forcible nature of treaties, have a reasonable chance of achieving benefits, and treaties should be the best mechanism available among alternatives to solve the problem. And if you look at these 4 criteria and look at the right side of the presentation, AMR is a transnational problem. End goal needs a coordinated action. AMR treaty can achieve institutionalized accountability mechanisms, and non-binding governance tools do not have the accountability mechanisms that treaties have to ensure compliance. So some of the authors have advocated for AMR treaty, and they also recommended different forums for AMR treaty. It can be under United Nations General Assembly. There are strengths, limitations, and strategic considerations. Or you can put AMR treaty under WHO, FA, or OIE. Again, there are strengths and limitations. And it can also be a plurilateral agreement. Plurilateral agreement is few countries who are powerful can come together, design an AMR treaty, and escalate it at global level. But again, it has its own limitations. So the reason I have exposing all of you to this complex environment of legal and trade issues in AMR treaty, because we have potential opportunity here to advocate for an AMR, a global treaty. 3 models of global treaty designs. One is universal responsibilities or differentiated responsibilities or individual responsibilities. The message is simple. Either you apply it universally, like equally among all countries. Today, this is the treaty and apply to every country. But it has its own limitations because individual countries have different problems. Differential responsibilities is more equitable as it considers differing abilities of high-income countries and low-middle-income countries. Individualized responsibilities, potentially, it's most equitable and in good faith and fairness. So think about this, whether this is a good way to deal with a problem. So what we understood from the previous slides. So in the next 5 minutes, I will cover, and I'll be within the time limits of 45 minutes given to me. So populations have social, trade, environmental, and economic origins. That's what we saw now in the previous slides. There's a need for policy coherence strategies. However, which approach can be used to achieve policy coherence? The real challenge for a policymaker is how do we balance the rising threat of AMR with negotiating the least restrictive trade policies, because we need to balance health, economy, and environment. So one approach which we are working here at Prasanna School of Public Health is health in all policies approach to combat AMR. Some of the principles of health in policy approach, which also can be transcended to AMR, are legitimacy, because it should be based on the rights and obligations conferred by national and international law. Accountability of the governments, transparency of policy making, and access to information. The core success of sanitary and phytosanitary agreement lies in transparency to the information. So it's very important also we give access to information. Participation, sustainability, and collaboration. So salient points in policy coherence are: policy making at country level cannot be seen in isolation from globalization, global development, and global governance. It influences and can be influenced by decisions made beyond national borders. At the international level, intergovernmental organizations and structures can contribute to multi-sectoral action on health and development outcomes. Securing high-level political commitment to an intersectoral initiative is vital. Politics is very important, and political science is very important for AMR, addressing AMR problem. A successful partnership across sectoral boundaries requires active participation and goodwill. And where different levels of governments are involved, you'll have different advantages as well as complexities. So factors influencing policy making, you need to understand content, context, actor, and processes. And you need to look at evidence, experience, judgment, lobbyist, policy content, resources, if you are trying to advocate or lobbying for AMR problem. So it is not one component, but you need to see a problem in a context. Activities that are likely to prove useful is you can create a regular platform for dialogue with other sectors and stakeholders, like how Prevent It project has done a commendable work in exchange of knowledge, creation of knowledge. I think that's a very good thing. Advocating for AMR prevention and determinants of AMR to be addressed in public discourse. Conducting training in relevant areas, AMR agenda management, AMR policy evaluation and negotiation. Policy agenda setting is very important. What goes into the agenda is the key for the next steps in the policy cycle. If we are not reaching the agenda itself, we are not reaching the next step in or nowhere. So promoting synergy and negotiating trade-offs between sectors is required, and you need to build the knowledge. So I stop here with a small quote, which is given in the health and policy approach is business as usual, thus cannot be an option and transformative. It is needed. As the challenges are highly interdependent, a new, more holistic approach is needed to address them. To realize the future we want for all, a high degree of policy coherence at the global, regional, national, and subnational levels will be required. Thank you. Thank you to all the organizers of Prevent It, Chitkara University, all national international universities and international NGOs, Manipal Academy of Higher Education, and Prasanna School of Public Health. Thank you.
Thank you, sir, for your enlightening information. Usually we don't come across these kind of concepts like trade agreements, governing bodies, etc. Like students also tend to overlook these, but these holds the key in understanding how the antimicrobial how to contain the antimicrobial resistance at the administrative level. Now I would like to proceed with the interactive session. Like few of our participants have asked questions, like we cannot take all of them due to lack of time. The first one is there any difference between substandard drug and counterfeit drug? How to identify the counterfeit drug as a general public?
I suggest you refer to the reference which I have given in the presentation. I'm not an expert to say how to identify the counterfeit and substandard drugs. but I urge you to refer to that particular website. But what I think is counterfeit and substandard drugs can be controlled if we standardize technical barriers to trade and harmonization of the commodity exchange in trade agreements.
Sure, so the participants are going to look at it. And the second question is, according to you, why the guidelines cannot be of binding in nature in order to make things more operative and strict?
Yes, thank you. As I said, policy always has to be understood in a context. When I say context, the laws and regulations in terms of, for example, sanitary and phytosanitary agreements are territorial. When I say territorial, it's a nation which will decide what standard I will set in. International standard setting organizations like WHO, FAO, OIE will give the highest level of standards, but it's for the country looking at the context and other trade-offs and the conflicting goals and the balancing goals. The implementation can only happen at that level. There are two other articles, that is Article 19 and Article 21, which I mentioned in the presentation, that needs ratification of at least 2/3 of the members in Article 21. But again, the scope is limited when you say it impacts the public. But if you implement Article 19, it is automatically all the members have to oblige by 90. That's how the Framework Convention of Tobacco Control, FCTC, was implemented.
Thank you, sir. I guess we can take one more last question. The medical tourism has been increased a lot these days. Do we need to come up with some regulations to decrease the ABR spread?
Yes, definitely. As I told you, it's a different level of discussion which comes under general agreements of trade in services. There are regulations and technicalities which have been put in place, but however, to discuss the implementation of GATS and trade-related services, that is trade in services, I think this is not the forum to discuss in detail. But I urge you to refer to trade in services, especially trade in services. Again, there are 4 different modes, and which mode we fall in, it depends on how our regulations can be controlled.
Thank you, sir. I hope the answers were satisfactory. Now we have reached the end of the webinar program. I would like to thank Dr. Sanjay for his valuable talk on need of policy frames, policy coherence and coordination, action in trade agreements, addressing the raising maniac of AMR. We would love to have you again on our platform, sir. Thank you for such a great response from all the participants too. I hope you all enjoyed the session. We do apologize if anyone had faced any technical issues. And as I said earlier, the recorded version will be available on YouTube channel Prevent It. Thank you for all the participants. We appreciate your presence. And we hope to come up with another interesting topic in the coming month. Thank you. Stay safe.
Thank you.